Hello everyone, my name is Tara Young with the Carleton County Extension Office. Emma Severance behind the camera today, the St. Louis County intern. Today we are preg checking with Dr. Tony Dank, the USDA Veterinarian. Let's go.
Good morning, I'm Dr. Tony Dank and talking with you today about a few different ways that we can preg check cattle. The four ways that come to mind are regular palpation, ultrasound, blood test, and milk test. Starting with the most accurate, I consider ultrasound most accurate for the first approximately 90 days of pregnancy. We're able to see the full fetus, and development is fairly consistent across breeds within the bovine species. This gives us a chance to be as accurate down to the day level and detect early pregnancies. After ultrasound, manual palpation allows accuracy out until probably 7 to 8 months of age before the calf is almost ready to be born. This is really variable based on development as well as information provided to the veterinarian. If I have to guess from 0 to 9 months, I have a lot less accurate as opposed to in a 2 to 3 month window. When I'm manually palpating, I feel for different cardinal signs of pregnancy, such as the slip of the fetal membranes, the placentomes, where the calf is connected to the placenta, as well as the baby itself. And the baby itself will give me a better opportunity for aging. I can age by the placentomes, but that is highly variable, so that's where we get a lot of variability later into the season. The third method that I mentioned was blood testing. This is where we collect a sample of blood from any vein in the cow, and we can send that blood to the lab and they look for certain hormones associated with pregnancy. The benefit of this is that it doesn't necessarily have to involve a veterinarian, while the downfall is you do not get an answer of how far pregnant she is, just that she is pregnant or not. Milk testing is similar, except that the sample is collected by milk. Many dairy farmers may be familiar with this by DHI. As I mentioned, ultrasound is another method of pregnancy diagnosis. This model, I take a probe into the rectum of the cow and generate an image on the ultrasound. I am then able to see what is going on inside of the cow. This cow does not appear to be pregnant, as I see open sections of uterus in the middle and towards the top of the screen.
This is an ultrasound of an approximately 4-month pregnancy. You can see the heartbeat as I come through the chest and the tip of the nose at the bottom of the screen.
As I mentioned previously, blood draw can be accomplished from any vein in the cow. I typically find the tail vein the easiest to access, as we have the cow restrained in a chute and don't have to provide extra restraint for her head to access the jugular vein. To draw blood, I elevate the tail, and with my finger I feel for an intervertebral space between vertebrae and the tail. I already have my blood tube ready with a vacutainer needle and a vacutainer hub. I insert the needle into the cow and then puncture the blood tube. And when the needle is in the vein, the tube provides suction, taking the blood sample and then submit for testing. I remove the tube and I remove the needle. Some of the benefits of the veterinarian doing the pregnancy testing is that I can give you an answer right away how far pregnant that cow is and approximately where she is in gestation. Milk and blood testing obviously do not have that advantage, and you have to wait sometimes days to weeks to have an answer. One benefit of testing via blood is that if you are looking to do other diagnostics such as looking for Johne's disease or prevalence of other disease in your herd, you can collect one blood sample and get multiple answers in one session.